A huge step forward for cancer care here at Stanford. Not only is it long overdue news for cancer patients with specific tumors, but it's environmentally friendly as well.
Here's where the magic happens.
Okay, pretty loud in here.
This is the world's tiniest superconducting accelerator that generates the protons and targets them towards the patient at nearly the speed of light.
How significant is this proton therapy clinic for Stanford?
This is not only the smallest, but also the most advanced because we have built-in CT scanning right where the patient is. It allows us to target tumors extremely precisely within patients. That allows us to concentrate the maximum therapy on the tumor with the minimum collateral damage to the rest of the body.
This is pretty significant, James.
Right, exactly. So most standard proton facilities require a whole new building, brand new construction, just to fit the machine and all the devices used to aim the beam at the patient. Here at Stanford, that's no longer necessary. The cyclotron is much smaller. The cyclotron itself does not move. It's called a fixed beam, and instead we move the patient. And it allows the entire proton center to be shrunk into the footprint of what a standard radiation machine would require.
So this is significant. This is great for pediatric patients?
Oh, this is going to be great for pediatric patients. We're so excited to have it here. Protons, one of the best uses for it is in these pediatric patients because it can really lower the amount of radiation going to normal tissues in the body. You can imagine in these children whose bodies are still growing and developing that the effects of any radiation therapy to normal tissue really matters.
In typical therapy, the patient would usually lie down, and that can be very anxiety-ridden, intimidating, especially for kids.
With this ability to be sitting up, to be an actively engaged participant, to not just feel like you're pinned to a table and having something happen to you, we think is going to be really helpful to a lot of kids.
As someone who has worked on cases on treatment for cancer, bringing this whole setup to Stanford, what does that mean to you as a physician?
For our patients, particularly ones with the most complex or difficult to treat tumors, that we can give them a treatment that is effective and that causes less side effects. And anything that we can do to improve radiotherapy, which is used for about 2/3 of all patients with cancer of any type, it's a real advance in cancer therapy overall.
I'm thrilled about this. I think this is so significant, and this really feels more equal, more fair, more access, and just one more way that we can try to do the best thing we can for our pediatric patients and patients in general.